with Sarah and Sarah today. Introductions coming shortly. We'll spend some time in a panel with them, do a little bit of scenario role play, and then come up with questions and answers as well. So as we're going through this panel discussion, please do make a note in the chat if you have specific questions, examples of things that you want to hear from them, tricky situations you're worried about encountering that perhaps we could troubleshoot proactively together. So those are all very appropriate conversations for today's panel and the discussion, and we're just really excited to get started. So with that, I'm just going to double check to make sure we're not missing anyone on the phone today. Looks like that is not the case. And I'll just go ahead and dive in. So want to welcome Sarah Francois. Many of you are probably already familiar with Sarah, who is the Director of Fund Development and Marketing at Progressive Community Health Center. Hi, Sarah. And then we have Sarah Diedrick-Kasdorf as well. So Sarah is the Deputy Director of Government Affairs at the Wisconsin Counties Association. And Sarah, how long have you been with the Wisconsin Counties Association? Spring chicken or for just a while?
I hate to admit it. I've been with the association. It's been over 29 years. I'll hit 30 years in September. So it's been a very long time that I've been working with WCA on a variety of different issues. Currently working though on issues related to health and human services. So I have a great appreciation for the work that all of you guys do on a daily basis.
Well, thank you so much, Sarah. Sarah Francois, I should have asked you any opening comments before we dive in. How long have you been with Progressive and what do you focus on with your advocacy efforts?
So I've been at Progressive, April 1st, it will be 13 years. So I started with Progressive when I was a baby. As just a little outreach coordinator and have grown, and along the years that has also, along with my roles and kind of responsibilities, I've also taken on the role of advocacy leader at our organization as well. Probably been in that role 5-6 years. It's hard to count. Sarah can relate. After you've been somewhere long enough, you're just like, I don't know. It felt like yesterday, but it was actually 7 years ago. And we
right now, I think we're all in the time soup. You know, it's hard to say what's going on within the last year. Was that 10 years ago, right?
If I give her the information that says we can do this for the people who live in
I'm going to go ahead and there you go. Got yourself muted. Thank you. Sorry about that, Sarah Francois. Go ahead.
Oh, no, that's fine. We have a board-led advocacy committee actually at Progressive Community Health Centers. So I help staff that committee. And then we have board members who also participate in advocacy activities as well. So that's kind of been how our sort of advocacy world has started and sort of evolved as an organization. So it's something I really enjoy and kind of ties in with a lot of the other outreach activities and things that I oversee as well, in addition to the funding side, because I'm also on the fund development end and do a lot of our grant writing and other things. So of course, it all sort of ties together, which is nice.
Thank you, Sarah. Then Sarah Francois, let's begin with you. What are a few things that you like to know about a lawmaker before you meet with them? What information is useful to you?
So I often go and look, it kind of depends. If I'm looking more locally, I definitely want to know both locally and on the federal level, but definitely want to know like where they live, where they're from. Are there certain connections that can be made there? And a lot of times you can find this information just by looking at their websites. Many of them are active on social media as well. So you can kind of, I don't want to say stalk, but you can kind of do some investigation on social media to sort of see what both their political priorities are, but many of them, we have to remember they're also people. And so they have personal lives and they may have families and other activities that they enjoy doing. And you can kind of get insights into those things to really sort of help build a foundation for what you want to talk about. Obviously, you're going in for a certain topic, most likely. Hopefully, you have an agenda that you want to, talk about with the lawmaker. But I think recognizing that they're people first is often an important step to it, because it helps you build sort of a more friendly relationship, so that it's not just like strictly business. It can you can sort of break kind of the ice there and maybe create some common talking points. So locally, especially, I always kind of look at what neighborhoods they're from, what their district is like, who they're serving, and try to find some commonalities there, and also see what committees that they sit on. Do they have a specific interest in health, or are they more on the education side? Because if they're on the education side, maybe I can talk about our school-based oral health programs or those types of things. So find ways that you can really match up and create some common interests, I think is really important.
Thank you, Sarah. And Sarah Diedrick-Kasdorf, I'll turn it over to you. And I should have mentioned beforehand in your introduction that we specifically reached out to you, not only because you've been in this position for a while and are certainly seasoned in these efforts, but also I think it's important for Health Center advocates to kind of hear how this works in other organizations as well, and tips and tricks outside of just the health space. So counties work on so many different issues. Figured it would be interesting to hear your approaches and nuances as well. So Sarah, what do you like to know about a legislator? What do you look up in terms of their voting record or past before you meet with them?
Yeah, there's a number of things, that Sarah had already mentioned that we think is important. Obviously, we want to know what political party they're from. We want to know, how long they've been in office. Are they new? And so you need to guide them a little bit through the issues. It helps you to understand a bit more if you know how long they've been in office, whether or not you can just jump right in a conversation with them, or whether or not they need, background information on whatever issue it is that you need to talk to them about. It's helpful to know what committees they sit on, whether or not they chair a committee or not. We like to know about their background, for example, were they, before joining the legislature, did they own a business? Were they a farmer? Did they, are they a lawyer? We don't like to know a little bit of background about them. You talk about some of their family stuff, things that you might be able to glean from the internet with regard to some more personal aspects of their lives without being, as Sarah said, too much of a stalker there. We also like to take a look at their legislative interests to see what they've, the types of bills that they have supported, the things that they typically will oppose. What types of legislation will they typically co-sponsor or tend to author? Is it more on the healthcare side of things? Is education more their issue? Is it agriculture issues? Are those things that they really tend to gravitate toward? For us, over the last several years, one of the themes we've really tried to instill in our members is relationship building with your legislators, that it's not a one and done. We want you to be able to see them in the grocery store and say, hey, how you doing? Ask about their family. How are they doing? It's so, in order to do some of those types of things, it's not always just about their political record, but as much information as you can glean from them as possible will just help you with some icebreakers in getting some of those conversations started. But for us, the relationship building is so important. As Sarah said, one of the things we tell our members all the time is legislators, they're regular people just like you and me. They have families, they have personal interests, they have kids, all of these other things that for the most part, everybody can relate to in some way, shape, or form. And it's often those types of things that you can use to really build your connection or your relationship with the legislator. Sometimes for us, we tell our members, okay, so maybe you struck out on your conversation, for example, but you've built that relationship, you've made that connection. And, for us, it's critical just to learn as much as you can and find different ways to build connections with them. Do they belong to the Kiwanis Club? Do they belong to the Lions Club? If so, maybe you want to take a look into some of those organizations as well. Or at least, be familiar with what some of those organizations do that we know they're a part of. A lot of this information, you can find it real easily on the legislature's website, from the Blue Book. They all have bios, on their legislative pages that say.
Sarah, would you describe what the Blue Book is for anyone who's not familiar with it?
Sure. It's a book. It comes out every 2 years. It's actually blue. And it lists a number of things about the state government. It'll say, who's the governor, who's the lieutenant governor, who are all the legislators, who's in the Senate, who's the Assembly, and it provides some background for them. It shows the district, it gives their addresses to where they live. It talks about such things as, they're married. Thank you, Jeremy. Mine's out of reach. But it talks about their family. It'll say they have so many kids. They went to this college. So if you went there too, or know somebody who did, or one of your kids goes there, great segue. Where they went to high school. It talks about the organizations, clubs, churches that they all belong to. It's all in there. So it gives you it's an easy way for you to really get some of that more personal information about your legislator. And, going to the Blue Book, you don't really have to feel like a stalker, because it is out there for public consumption. And then, it just gives you sometimes an icebreaker, a starting point.
Sarah, this isn't one of our prepared questions, but I'm curious, how do you balance that sort of schmooziness, which maybe sometimes people don't feel so psyched about, balancing when you're also kind of coming in with a legislative ask? How do you, maybe I'll start with Sarah Diedrick-Kasdorf for this one. How do you balance that need to build a relationship without coming off too schmoozy?
Yeah, people will tell you I'm not the schmoozy type. So for me, it may not be as big of an issue. But, over the years, I've really come to learn, like when I started this job, now I'll age myself here, but I was 21. So when I was 21 going into legislative offices, it's a little bit intimidating, because at the time you look at these legislators and you think, oh my goodness, these are legislators. They are such important people. I need to be, extremely respectful and this and that and everything else. And of course, you always want to be respectful, don't get me wrong. But, over the years, I've come to learn that they are just regular people. So, really, it's just as simple as, hey, how are you doing? Have you been in town long? Did you stay last night? Did you drive in this morning? Just, you come up with these little things to just, throw out there. Some of it really depends upon whether or not, if they've got pictures of their kids on the desk and, they've got kids. Oh, look at are those your kids? Oh, they're really cute. How old are they? Or, just different things like that. You can look for cues in their office, just really easy things to start the conversations, break the ice. There is a lot of interesting things that you'll find in a legislative office. I mean, there was a full stuffed bear in an office. They, all these various things that when you just take a look, you can just walk in and just to break the ice. Oh, that's interesting. Did you shoot that bear, or where'd you get the bear from? Or, whatever it may be. There are cues in offices to help you out. Again, just some of the things as well that you'll find in the Blue Book. It doesn't hurt as well to ask folks that that may have a connection with them. Reach out to them ahead of time to say, hey, I'm going to meet with Representative so-and-so. I know you have a relationship with them. What are they like? Do you have some tips? That's always a helpful thing to do as well.
I find that really helps build confidence too. The more you know about the person, the more you feel like you're prepared to face what's going to come up in that meeting. I think what's also been interesting about the virtual setting is that we're actually seeing people's homes sometimes these days. Now, sometimes they're still in the office, but it does give you a lot more insight about them, which I think I find interesting, at least too. I usually don't comment on like what pictures are behind them, but it gives you a sense of who they are as a person a little bit too. Sarah Francois, anything to add on that sort of how you create a relationship without kind of coming off oily feeling, perhaps?
Yeah, I mean, I think it also helps. I have the benefit of both living and working in the same district. So when I'm typically going to like a state legislator's office, I'm a constituent of that district as well, which I think is always a plus. It definitely helps. So, I live in what was once David Crowley's district. Now, of course, he's the Milwaukee County Supervisor. I actually see him and his family out quite a bit, just doing like normal everyday things. And it's not that he would ever be able to pick me out of a crowd, but if I was like to be having a conversation when he was a state representative, it's like, hey, I saw you at such and such, event, or at the park last weekend, or whatever it might be. If that's a situation that you might find yourself in, or even my alderman, we always went to the same gym. So it's like, I always saw him at the gym. And again, would probably never know who I was outside of that setting, but it again just kind of reinforces the fact that we're all real people. We're all just kind of in the same boat and living normal lives as well. So I think, uh, again, not making it your whole topic of conversation, but if you have something that's a tidbit that you can throw out there and kind of break the ice a little bit, I think it definitely helps. And of course, always gives you the extra leg up if you do happen to be a constituent, because I think they'll certainly be much more open to what you have to say, because obviously you're a voting member of their district as well. So it does really matter.
Rochelle, if I could just real quick, one thing, because I don't want to state the obvious here, but sometimes folks think that because their name is in the calendar, for example, that the legislator knows who you are and why you are going to speak to them. It's the same as when you run into them in public. Maybe you've met with the legislator in their office 5 times over the last 3 years. We always tell our members, never assume they remember who you are. So when you see them in public, when you walk into the office and you meet with them, even though you think they should know who you are, because it can get really awkward really quickly if they don't remember your name. So, one thing we always say, make sure you reintroduce yourself every single time until you have that really close, good bond connection with your legislator and they know who you are. There are times they may you walk into the office, or you'll see them in the hallway of the Capitol, and they give you this look like they know, like they recognize you, they know what your name should be or is, but they just can't remember. So always, just to avoid some of that awkwardness and this feeling of, okay, I recognize you, but I don't quite know who you are. As obvious as it is, make sure that you always, identify yourself and who it is that you're representing.
Thanks for that, Sarah. I think that's a really good tip. I kind of walk around with one hand extended with a, hi, Rochelle Andre with the Wisconsin Primary Healthcare Association. Great to see you again, like ready to roll off my tongue at any particular moment. Now, I haven't gotten to do that yet in person, but I think the risk of them not knowing who you are is worse than the risk of, them for some reason, or you feeling insulted that you're reintroducing yourself to them. It's always good to double check that. So I think, this session is for the next level advocacy. So folks who have probably done some advocacy work before, met with their legislators, but want to practice hard skills or hard conversations. And I hear from some advocates that they're really concerned about conversations kind of going sideways, go off the rails. How do you bring it back? How do you stay on topic? So Sarah Francois, could you fill us in on a time where that happened, where a conversation got off track, and how you brought it back onto the conversation that you were hoping to have?
I think it happens a lot, again, because we often make assumptions too that, particularly in the healthcare world, right? We're community health centers. We represent a very distinct segment of healthcare in Wisconsin. We're not a hospital or, a big health system and things like that. So a lot of times legislators might not necessarily know who you are as a community health center, or what you do, or what makes you any different than a big system, a big hospital in your area. And so oftentimes we'll kind of go in with an agenda. And of course, you always want to, again, do a little bit of a refresher of who you are, why you're there, that type of a thing. But it's happened a couple times where we've been in meetings and policy issues have been brought up that have nothing to do with community health centers, health policy issues, but maybe they impact health systems more or hospitals more. And so we might be going in and asking for, money for like our state community health center grant or whatever it might be, tied specifically to community health centers. And it's happened more than once that a legislator has said, well, we're already giving you money through some other source. And it turns out that that's actually tied to hospitals and not health centers. And so it kind of goes off on tangents about, well, this funding is already available and those types of things. And it's about bringing the conversation back and saying, hey, yeah, that's an awesome program. And then just kind of reminding them that doesn't actually apply to us because of our community health center status. And let me just remind you a little bit about what we are as community health centers and how we're funded and how that makes us different. And, sometimes they're really for this program, sometimes they're really not. And so, if they get their head sort of wrapped around what that is, I always just sort of redirect back to, we're unique as community health centers, and this is sort of how we function, both in tandem, but also very differently from other healthcare providers. Because I think that that's an automatic assumption that things that might be impacting large health systems or private practices, is the same for community health centers, and it's just not. So I again can really only speak to the healthcare side of things because that's what I have the most experience in. But I think just finding ways to acknowledge that what they're saying, oh yeah, like I completely understand, or I definitely I'm going to do some more research about that line of the funding that you're talking about, but to my knowledge, that doesn't really impact what we're doing here. So this is what I really came here to talk to you about today. Let's maybe sort of redirect that conversation. And I think again, you're typically working in very small periods of time. And so it might be 5 minutes. You might get 10 minutes, maybe 15 if you're lucky, but probably not. And so, it's about redirecting as early as possible. And, again, not brushing it off, acknowledging what they've said, but then, politely redirecting the conversation to, this is what I really have to talk about today. And hopefully we can continue to discuss other priorities in the future.
Those are really good reminders, Sarah. I meet with a lot of legislators virtually this session, and even folks who might consider themselves health center champions, often I find need a little reminder of how we're different from free and charitable clinics, for example. That comes up a lot. And so someone will start talking about not billing or, something that a free and charitable clinic is up to. And even then, there's a redirect back to, let me remind you, we actually provide primary care, behavioral health, and dental services, regardless of a patient's ability to pay, but we do bill Medicaid. And, I think having that little elevator pitch of a reminder to get folks back into what the community health center model looks like is a really good thing to have in your back pocket for any conversation with a legislator. Sarah, do you have a good example of when something went off track and how you brought it back?
Not an example per se, but the primary example I can think of was actually an example of when our members did not redirect and did not come back. We had a group of counties that would come to Madison every February and meet with their legislators. And we decided one year that, in order to make the meeting more productive, that we would start a little earlier than usual. We would prep our members, give them, talking points in which to use when they went when the legislators then joined us in the hearing room, 45 minutes later. And our members aren't, professional lobbyists. They're not, our members are county board members. So we have retired farmers, retired teachers, our members tend to be somewhat older in nature as well. And so, sometimes they're uncomfortable talking about some of the issues we want them to talk about just simply because it's not in their bailiwick. And as we know, people are most comfortable talking about issues that they have a lot of familiarity with. So sometimes it's not always legislators that get off track. Sometimes it's our members as well that get off track. And so, for them, we try to talk to them about having some self-discipline, because that whole meeting that I referenced, we spent the whole time talking about agriculture, because most of our county officials in the room were farmers. They came from agricultural communities. Those were issues that were important to their constituents. But I needed them to talk about, issues included in the state budget that impacted counties. And they didn't, really have much of an interest in doing that. Again, sometimes getting off topic for a while isn't so bad, because in a sense, it's all part of that relationship building process with your legislator. And as we always say, a conversation should never be one and done. So if things do get off topic, we always make sure we have a leave behind, a piece of paper that explains the issue really simply. Here's the issue. Here's our ask. Here's the current status. And here are some talking points, so that if sometimes things go a little bit off track, the legislator still has that piece of paper. They will hand it to their staff member, and their staff member will review it. And again, you may have covered this in one of your previous sessions, but I cannot underestimate, the value of having a good relationship with staff, because oftentimes they are the ones who are advising their bosses. So for us, that leave behind is really critical. So, if your conversation goes off track, yes, you want to have some strategies in place for redirecting. you know, whether it's some completely off target where you say, you know what, that's a really interesting issue, Representative. I would love to meet you for coffee in the district to talk about that. But in the meantime, I know we only have just a few minutes left here to speak. So let's, you know, so if you don't mind, you know, I'd like to talk to you a little bit about funding for community health centers or whatever the topic is, and try to, you know, in a very gentle way, try to redirect them. You know, obviously sometimes they'll talk about things that are, you know, that you absolutely, you know nothing about, and you sit there a little uncomfortably. Thanks so much. Learned a lot about that topic. Now, you know, now I think it's really important that, you know, if you don't mind, I'd like to focus a bit on, you know, whatever the topic is that I'm in there to talk to them about that day. You know, they say flattery gets you everywhere. Commend them for being such a, you know, a great advocate on that particular issue that they wanted to talk to you about, but then again, redirect over to your issue. And again, this is where the follow-up's critical, because while you might have 15 minutes for a meeting, maybe they monopolize, you know, 10 minutes of that, and you only have 5 minutes then left for your topic. You know, again, it's the follow-up that's critical. It's the thank you note, whether it's handwritten, whether it's email, and within that thank you note, you can reiterate the points that maybe you didn't get to in your meeting. Follow up with staff, you know, have a follow-up conversation with staff. The next week, give staff a call and say, hey, just want to follow up with you guys on this. Make sure you saw the information. If you don't have it, you know, be happy to send it again. You know, there's, you know, I'm sure if you go online, there are lots of different, you know, tips and strategies for how to redirect a conversation. But really, it's more so of acknowledging to me that you're hearing what they're saying, because you don't want to be dismissive. So you can certainly acknowledge what they're saying. I understand that. That's, I'm sure that's a really important issue. You know, love to, you know, talk to you more about it, but, you know, we have 5 minutes left, and you know, this is what I'm here to talk to you about today. There are ways to do this. You know, I haven't found too many instances really in my career where we have gotten so far off topic that I've never had the opportunity to go on and speak about what it is we're there to talk about. But it does happen. And I think a lot of it happens more so when folks are a little more uncomfortable with the topic that they're in to discuss. So probably one of the easiest ways to, you know, keep that from happening as well is make sure that you are fully prepared for your meeting.
Thank you, Sarah. Anything else to add, Sarah Francois, to that question?
I would just reiterate that the relationship with staff is huge, and the staff changes a lot as well, but it also gives you an opportunity if a lawmaker's running out, you know, and it's like, hey, it's that 5 minutes. And then I would definitely put as part of the conversation, is there somebody on your staff that I can follow up with? You know, and just talk a little bit more about the issue with. So even if you feel like your time with that lawmaker has, you know, sort of been cut short or whatever it might be, recognizing again, as Sarah mentioned, that the staff oftentimes has even more of a pulse on what's actually happening and can help guide some of those conversations in the future. I think that's definitely huge as well.
So Sarah Francois, have you experienced a legislator who was kind of putting you in the spot to weigh in on a controversial item that wasn't super relevant, but they kind of wanted to hear how you were going to respond to that? Has that happened before?
You know, I was thinking about this one, and I guess one of the benefits I have of both sort of being in the district that I am is that most of the, at least local legislators that I encounter on a regular basis tend to be pretty much on board with a lot of the legislation that, you know, we're trying to promote and gain support for, which I think, you know, it makes it a little bit more unique on my end than it would be in other places. And so I certainly recognize that those uncomfortable situations probably happen elsewhere in the state more than they do here in Milwaukee with a lot of the legislators that I speak to. However, you know, I think there's some key ones. Medicaid is always a big one that comes up when we're talking about health centers, because some people feel a very, you know, specific way on Medicaid, on how the program is funded, on, you know, who qualifies for Medicaid and who doesn't. And I think because of our unique status as health centers, obviously we serve a lot of patients that rely on Medicaid. But it's distinctly kind of two separate issues. And I know even on a federal level, our, kind of funding, people don't view community health centers as controversial. They view how we're funded as controversial. And so we have to be able to figure out how to sort of delineate those, and just make it clear, again, what our specific priorities are. And also, make it clear that, again, redirecting what your points are that you're really there to speak about. So there have been times where we've gone into meetings and, stuff has really started cropping up about Medicaid in general. And it's like, I don't know the ins and outs of every Medicaid program that there is and how everything's funded and everything else. I do know, obviously, that it's an important resource for our patients. It's something that we definitely want to stabilize. We definitely want to, continue to have access for our patients. So that's what I really tend to speak about. Speaking about the things you're comfortable speaking about and kind of figuring out how to redirect back to those areas and staying away from the true controversy of it all. But again, I have to admit, I haven't run into a ton of controversy with most of the legislative discussions we have had. I do know that, just speaking on the federal level, I think it's no surprise, Senator Ron Johnson tends to be, on the more fiscal side of things. So when we're talking to him about different things, we want to be sure that we're focusing it fiscally, because that's really what he cares about and what he focuses on as a businessman. And so figuring out how to frame conversations that way. So a conversation I might have with his office is going to be very different than one I might have with like Gwen Moore's office, or even somebody else who's more local and, views community health centers in a different way and understands how we're funded and those types of things. So I think it's just, again, knowing who you're speaking to and being able to be prepared to, redirect as necessary. But I haven't had any, all out, like Sarah's mentioned, like altercations where I've just felt so uncomfortable that I just have no idea what to do, and feel completely crippled. I think generally, as long as you're being mutually respectful, you can maintain that level setness, I think.
Sarah, too, what about to that question? Any examples come to mind where they really wanted you to weigh in on something that you knew was dangerous to weigh in on?
Yeah, I mean, there are times where, we'll get asked by legislators, so what is your position on Medicaid expansion, or where are you guys at on the legalization of marijuana? Don't you think you guys should be supporting that? Or, maybe you should be opposing this, or, whatever it is. On these election bills, where are you guys at on these things? My gosh, voter suppression. You guys ought to be out there. Why aren't you more vocal talking about this stuff? We get this all the time. And so, we're asked to weigh in on a lot of things that may not be the reason we walk into an office on a particular day. I mean, we're a nonpartisan organization. So, obviously we don't want to get into the middle of, bashing one side of the aisle or the other side of the aisle. That never goes over well for folks. And so,
do you feel like they're baiting you, Sarah, in that situation, or they honestly want to know where you stand?
I think sometimes we're baited. Sometimes they just honestly want to know. Sometimes I think we go in and we'll ask for something and it's almost like, well, but where are you on this issue? In fact, I had a conversation with a legislator last week who wants to throw an amendment onto a bill that none of us are comfortable having him do. And it's like, well, but I'll run your bill through my committee if you do this. And I kind of had to do a redirect to, well, here's the reason we really need a clean bill. And it's important that we have this bill run through quickly, because if we don't, counties in the state are at risk of losing millions and millions of federal dollars that we put toward the child welfare programs. And I know, Senator, you have an interest in child welfare programs. You've introduced a number of bills on that topic. So, I mean, just last Friday it was, well, what about this and what about that? And so, these things do come up. A couple of points that I always try to keep in mind is, when legislators do this, sometimes it's real tempting to, get engaged and engage in that conversation. But I have to remember, I am here representing the county's association. I'm not here representing my personal opinion on a particular issue. And sometimes, the work positions and the personal positions don't always mesh together very well. And so you just have to remember why you're in there. I'm in that office representing counties today. And as a result of that, I'm going to, be very clear with you and say, we have a membership that has many, many different positions. We've got counties that are very progressive. We have counties that are really conservative. And so oftentimes when we bring these issues to our members tend to punt. And they say, we don't think we're going to weigh in on this issue. Let's not take a position on marijuana. So I may say, yes, I hear what you're saying about why you think it's important for us to support this or oppose this position. But for us, our positions are, they come from our board of directors. They come from our membership at our annual business meeting. And they've discussed this issue and they have decided that they do not want to weigh in on that. So it's oftentimes it's just a matter of explaining to them why your association has or has not weighed in on a position. It's nothing personal against me. And, I've learned over the years, don't take things personally. It's just a matter of, this is the position our members have taken on an item. Sometimes there are things that are outside the scope of what we do. And we just kind of gently explain, that's a municipal issue. That's not really a county issue. Therefore, we don't have a position and we're staying out of that debate. Sometimes too, we may know they may bring up an issue that we know isn't our issue, but we know of other groups or organizations that have an interest in that particular issue as well. And we may say, that's not really our issue, but have you talked to so-and-so or so-and-so? And if you don't know them, happy to make a connection between the two of you. There are things we can do to get out of, I don't want to get into a debate with folks as to why our organization, did or did not take a position. I'm not going to tell you about the debate that took place on the floor of our annual business meeting. My job is not to say this or that happened. This is our position and that's what was decided. And so, it can be uncomfortable. It can be, at times, and yet we just have to say, sorry, we don't have a position and we are not likely to take one.
So Sarah, you just kind of mentioned, I think several really great points in there on the personal versus professional and, making sure that you're kind of reflective enough to kind of identify what you're speaking to in any particular moment and kind of have a little gut check on that. But I appreciate your comment on almost a quid pro quo that can come up sometimes in conversations. I'll work on this bill if you're working on this other bill with me for that. Can I count on your support for that bill? And generally, how do you handle that? Are you making promises in these meetings that you didn't intend to?
If we don't have a position, all I can do is say, I'm happy to take this back to our board, take it back to the office, and we're happy to discuss it. That's all I can do. I really can't make a promise to somebody that doesn't fall within the parameters of the direction that we've been given by the membership and by our board of directors. And so
they get that, right? Like, this isn't a shock to legislators when you tell them that, right?
No, it's not a shock to them at all. They understand this. Sometimes they just think it's fun and, they want to, the more you know a legislator, the more they'll try to, to push you a little bit on things. Somebody that you've never really met before and don't have a long-standing relationship with probably isn't going to try to nail you on your first or second meeting with them. But the more familiar you get with folks, I think the more they tend to feel that they can begin to, maybe, I don't want to say cross some lines, but they can begin to push you a little bit more than what you may see in some offices that you haven't visited, say, as many times. But it's interesting that the quid pro quo piece, sometimes it's a bit challenging no doubt about that. Last Friday, I just had to, remain respectful, just continue to reiterate my talking points on the issue. After you hang up the phone, you can scream, yell, do what you want, go talk to your colleague and say, I can't believe this conversation I just had. But you really just need to maintain your calm and cool when you're in that situation. Because again, one of the things we tend to, find out as well is more often than not, you and your legislator are probably going to agree on issues. We find 80% of the time, we don't have too many controversial issues really as counties, but so probably 80% of the time we can get a legislator to agree with us. So to bash them over that 20% means you're putting that other 80% at risk and in jeopardy. So again, it's just very politely, again, some of the things we talked about earlier, being polite, redirecting the conversation, talking a little bit about process and how it is your organization comes to these various, positions on things, and just,
without still telling them how all the sausage was made.
Yes,
right?
They don't need to know. In fact, there's a famous quote, that actually ties lawmaking to sausage. Only they say as part of it, the sausage makers are offended by that particular comparison. So it's interesting. I never thought, I'd see a quote that tied lawmaking to sausage, but there is one out there and the sausage makers find it offensive. So.
Sasha, you have a question for our panelists?
Yeah, I do. For this thing where, a lawmaker might ask you to talk about another bill or choose another bill, Sarah, is this more for maybe lobbyists that get those questions versus members who are coming in to lobby, or, I'm just curious about that.
I will say, I think, when a constituent tends to come into a legislative office, I think that things get a little less hectic. I think things get a lot less controversial when you have, a constituent in than somebody like me who gets paid to go in and talk to these folks every day. They feel like, they have a right to harass me because I'm getting paid to go talk to them every day. And during the state budget, it's not uncommon. We'll walk into an office and there's not a day that goes by when the Joint Finance Committee meets that there's not an issue up that impacts counties. And they'll say, oh, here's the counties association. All right, how much money do you want today? And we'll hear that a lot because you guys aren't in their offices, 4 times a week during state budget deliberations. You're not going to hear those types of things from them like we do. So I think you guys too, are, you guys are professionals at what you do. So, you guys know what you're talking about. You understand your issues very, very well. And so, I think in those situations, I think you guys really are in a prime position to have some really great conversations with your legislators without getting too much pushback. Yeah, they might ask you about Medicaid or Medicaid expansion. You might get asked about some of those things, but you're not going to, get harassed about as many issues as say I might, just because there's so many issues that counties handle and deal with that I think we're more ripe for the picking than say you guys might be, when it comes, especially when you're going in as a constituent to meet with your legislator.
Thanks, Sarah. And, I think part of the effort here today is prepare folks for the worst, but not to expect the worst. These meetings are generally quite friendly. And hopefully if you're over-prepared, then you go in with confidence to handle something that comes at you from the left. We'll transition just into a little bit of role play for a short period. So indulge us in that here. We're going to ask wonderful Carly to facilitate. I'm going to be putting on my legislator hat here for a few scenarios. So don't mind me. And Carly, if you would just kick us off, and I believe our first scenario is for Sarah Francois.
Yes, so that's all I was going to say was that Sarah Francois is going to go first, and Rochelle, go ahead.
Well, Sarah, I know you work for health centers. Thanks so much for coming in today. I see a lot of your budget priorities here are really dependent on the revenue from medical marijuana. And, that's a really controversial topic. I would really love to know where you stand. I mean, it's something that's really impacting our communities, but it's a really tough topic. So medical marijuana, tell me all about it. How is that helping your health centers, or what's it doing?
I appreciate the question. I appreciate, the opportunity to spend some time talking with you today. Honestly, we do not currently have a stance on medical marijuana as it relates to community health centers and the priorities that we are currently working on. So it's really not a topic that we're choosing to address at this time. Definitely looking for other creative ways and conversations we can talk about, what we're looking to move forward in terms of community health center services that really don't have anything to do with marijuana and legalization of it right now. So that's not a current priority, but I'd love to talk to you about, perhaps the state community health center grant and how we might work together on getting some more resources through other methods into the community health centers to help the programs we currently have going.
Well, that makes a lot of sense, but how are you going to handle if that revenue is not in the budget? I don't know if we'll be able to fund some of those other programs.
Certainly, we understand that budgeting is a process, and at the very least, we want to be able to provide you with the information that we have available to us, and get you to see the true value that community health centers have in our community. And we realize it could take some time and prioritization, but I'm confident we'll be able to find some common ground on where we want to come down to in terms of long-term support for our programs and our patients.
Very,
well done, Sarah.
yeah, A+. You can see how the professionals do it. So we'll switch over to scenario number 2, which is for the counties association, Sarah. And so Rochelle is going to be the legislator again, and different legislator.
Imagine.
Yes. So Rochelle, go ahead and get started.
Well, Sarah, thanks so much for coming in this afternoon. I know you're working for the counties. I actually have my nephew. I think he's on a county board, and he's working on this committee where they've got the 911 center going on. I know there's a lot really occurring for the 911 center these days, and he was actually just elected 2 years ago. I think my niece worked on his campaign a little bit too, and I know that counties really have a lot on their plates these days, but it just seems like his county executive is really hard to work with, and folks these days just have so much to deal with, don't you think?
Oh, I know, Representative. That is such an exciting position for your nephew to be in. I'm really glad that he's able to participate in the board and that he's sitting on the 911 committee. And just so you're aware, I'm so glad that you mentioned 911, because 911 happens to be our top budget priority this session for the Counties Association. I'm sure, as your nephew has talked to you about, our 911 centers do not have the equipment that they need in order to accept text messages from folks, videos coming in from folks. We're really behind the rest of the nation when it comes to our 911 systems. In fact, we have a lot of 911 operators that are dumpster diving for equipment because.
Oh gosh, dumpster diving. Oh no, I'll have to tell my nephew about that. I heard that some of the funds for those garbage trucks too are getting cut at the municipal level too. And that's just a shame to hear about some of those recycling collection services, and the cities, they're trying to handle a lot today with the budget crisis going on too. And it really seems to be going off the rails.
Yeah, absolutely. Absolutely. It's unfortunate we have to dumpster dive, but did you know that a lot of our county 911 centers are working on equipment that is so old that is no longer maintained by the manufacturers? That is why it is critical for the state to provide us with the funding source needed to allow us to upgrade our equipment into 21st century standards.
Well done, Sarah. And I do see that so I started talking about a city issue, and I hear that you just soaked it in and then kept talking about the thing that you wanted to talk about. You didn't even say, hey, I don't represent them. Stop talking about that, right?
I had no idea, just so you guys know what topic she was going to bring up. I was looking at the scenario going, oh gosh, I hope she brings up something I know a little bit about.
I know you know about that one, Sarah.
I do. That one I know about.
Rochelle, did we want to continue with the scenarios?
Yeah, let's just do the last one for Sarah Francois.
Okay, great. So Sarah Francois, you're in the hot seat. And Rochelle, go ahead.
So Sarah, I know you're coming in, you guys have a lot of oral health service lines, but, I'm really concerned about dental therapy. I think it's going to be a really bad situation for patients, worse care. We can't be providing the most vulnerable patients with, folks who are poorly trained and, aren't coming in with a lot of information into practice and dental settings. So, I'm pretty bent on not supporting that bill here.
Well, I can definitely hear and respect your opinion on that issue. We at Progressive do provide a lot of dental services, actually. We have a pretty robust dental practice at our Lisbon Avenue Health Center. And we also, as community health centers, really view ourselves as training grounds for future workforce development as well. And so, I understand that your stance on the bill, but I also know that we have a lot of patients that need access to more service. We have waiting lists going up, upwards of 6 months of patients who are needing to get care, children who are not being seen that need to get care as well. And, I think we've been able to be pretty innovative in how we've delivered that care over the years, including implementing some school-based oral health programs and also, operating an emergency dental walk-in clinic. And those are all innovative things that may not have been at the forefront of a lot of people's positive thinking in the beginning, but we've been able to transform the programs into really being something that supports our patients and the needs of the community. So I would definitely encourage you to, maybe look a little bit more into the bill.
Yeah, thank you. I mean, I'm not going to support it, but maybe I'll come by for a visit sometime and we could walk through the clinic.
Absolutely. We'd love to introduce you to some of our staff members and the patients who have all been really, really happy with our services. We have an emergency dental walk-in clinic daily, so we're helping people in the moment be able to live better lives. And I think seeing it firsthand is really important.
Well done, Sarah. I think that's an especially tricky one when, maybe offhand when you're going into a meeting with someone and they have their mind set against something that you're working on. But I think it is still our responsibility to make sure they have the correct information, follow up with that information, and people change their minds on things. So just because I'm not interested today doesn't mean next time we chat, I won't have a new perspective on something. So these are the conversations that lead to those changes in perspective, right? Okay, that's it for our scenarios. I think it was cool to see Sarah and Sarah in practice. You've got a lot of very helpful phrases at your fingertips, I think, which are really useful, just like literally having a list of sort of redirect prompts or questions that you might want to use. So we'll just save the last 7 minutes here for Q&A from attendees. So if you have a question, please go ahead and drop it in the chat, something that you're like, oh boy, has this ever happened? Or I'm worried about X, Y, Z. Those would all be super good questions for Sarah or for Sarah. Or you're welcome to just unmute yourself and chime in with a question. Chris has a great one in the chat. So abortion in health centers comes up. Was asked last week if we do abortions by a Republican state representative I was talking to about the lead grant and a tax issue. So we've got both the combination of a need for a redirect, a highly controversial topic, that checks every box, Chris, that you could possibly have in a conversation. So maybe I'll start with Sarah on this one. Have you encountered that question before? What do you do?
Which Sarah?
Oh, I'm sorry, Sarah Francois. Let's start with you on that one. My bad.
We often, because we provide women's health services as well, we do occasionally get that question. And I always reiterate the fact that we do not perform abortions. We are a federally funded agency, so that is not something that we do. And I then usually try to redirect about the positive, women's health program that we have provided. We have very good birth outcomes at our clinic. And so I always try to redirect to those instead and say, we provide wraparound services and care coordination services. And these are some of the great outcomes that have come from our women's health and prenatal programming that we've established at our clinic. So again, trying to take the negative and really form it into a positive, you can usually find something there where you can redirect back to, yeah, that's not a topic I don't really want to talk about abortions, but let's talk about the healthy babies that we deliver and all of the other good stuff that we're doing.
I think on that question in particular, it is good to have some talking points and know what the legal requirements and restrictions are here. WIPCA does have talking points that I have in my pocket for that particular question, and we can share those with health centers too in preparation for advocacy days coming up in case you're worried about that particular one. But it is actually, we have a kind of an easy response if you know how to provide the response, because it is pretty cut and dry. Good one, Chris. I think Medicaid expansion came up a few times today and is really a hot and nuanced topic. So I'd be curious to hear from any other attendees on the line here today if you have talking points or concerns related to that question on Medicaid expansion. It's something that we're working through too as the WIPCA team on a daily basis as the environment continues to shift beneath our feet. So anyone on the call care to share how they've engaged in that conversation in the past when it comes up? Jeremy.
I'll just say that I was with a staff member of, I forget even who it was, who just seemed to really enjoy telling me and the other folks that I was just how bad Medicaid was and we should really get away from it. So, and that's not answering your question, but I was just like, this person really seemed to really enjoy letting us have it about how, Medicaid, there was no reason to expand it.
Thanks for sharing that, Jeremy. What did you just take it, or did you have, how did you respond?
I was pretty flabbergasted and just kind of sat there and took it and just tried to just kind of ask a couple of questions to be like, so this is what you mean, this is what you're saying. So, I mean. So didn't just sit there, blank face, not saying anything, but still wasn't able to engage, I'm hearing, in that dialogue, ask some questions. Sounds like it. Well, and what can be so tricky here is that, maybe you make the judicious decision to advance a positive relationship with the legislator with a trade-off of you're not getting your point across that day. And that's a tricky thing to decide in the moment. How much do I want to push on someone versus jeopardizing a relationship? Like, this person obviously is not going to change their mind about Medicaid in the call today. So what can I do if that's the assumption I'm operating under?
Yeah, and I think that's, Jeremy, what you did was totally great. And I think just listening to that person, and then you're just gathering information too. And maybe that second time you come in, you may have some answers for them, given the questions that they had. Like, you don't have to find those answers all right in there to try to convince them otherwise. Sometimes they just want to vent and you're there, unfortunately, but. No, and that's data collection, Sasha, as you just indicated, like just learning something about a legislator is extremely powerful so that we know where they stand, how do they frame an issue? That helps us be effective for maybe not in that particular meeting, but an indicator for their caucus or how to talk to their staff about it in a follow-up. Chris, it looked like maybe you're going to chime in on that item too.
No, Jeremy got it. It's a tough one. It's the timing of it and how much capital you talk about it and how you talk about it. But it's like everyone should be for it. It expands access and saves the state. Would have $634 million, invests other additional dollars into the state and healthcare. It's just got caught up in politics. The policy of it is pretty straightforward. And so I think it's just figuring out the right opportunities to talk about it and to pick our moment. And I do think in this budget, we are at a moment where there is space to talk about Medicaid expansion and not get ripped for it, particularly with the reconciliation bill and the additional $1.14 billion over 2 years on top of the $634 billion. So you're looking at $1.8 billion of savings to the state. I think that would resonate with, should resonate with just about everyone.
Thanks for that comment and question, Chris. I think that's another one that we will make sure to provide some recommended talking points on, because it is going to come up in some meetings that you all have. Can't guarantee everyone, but want to make sure folks are at least prepared with some options to talk about that item.
Yeah, I think it's not us leading with it, but if it comes up, so, well, what do you think? That's a lot of money, Representative so-and-so. Just want to get their read, do that information seeking that Jeremy did with the issue, and then kind of gauge how you're going to talk about it going forward from there.
Well, we are at 1 o'clock, so that's all the time we have today. I want to extend a special thank you to Sarah and Sarah. Want to flag the evaluation in the chat box that'll be sent out. It's just a 5-question evaluation. We want to know how we're doing. But thank you both so much for joining us. It was really wonderful to hear how you approach these challenging conversations, and hopefully leave here thinking, again, legislators are people. They are humans. They have motivations. They, value relationship development. And they're probably not going to put you in the hot seat unless you kind of come at them hot on something yourself, potentially. So just keeping all that in mind, and we'll continue to provide advocates with the information to set you up for success. So thank you all so much for joining us. And Sarah, especially, thank you both as well. Appreciate your time today. Thanks all.
Thanks very
Bye.
much.
Thank you. Bye.